I'm a fellowship-trained breast surgical oncologist. I'm Dr. Amani Jambakar, and welcome to my October myth busting series, where I bust a different myth about breast cancer every single day of the month. Today's myth: I have dense breasts. When I say I mean the many patients who I see in my office who tell me, I've been told I have extremely dense breasts. And in fact, the reality is most of them don't have dense breasts. These are the 4 categories of breast density. Category A is 10% of women, and these are almost entirely fatty breasts. You can see that this mammogram has mostly gray tissue and none of the fluffy white dense breast tissue. Category B is scattered fibroglandular densities, where there's a little bit of dense breast tissue or that white stuff you see. Most of it is still gray and fatty. This is 40% of people with breasts. A lot of times when people read their reports and see the word density, they assume it means dense breasts, but in reality, these breasts are not dense at all. Category C, or heterogeneously dense breasts, have some of that white dense breast tissue and some of that gray fatty tissue. But category D is the extremely dense breast category, and you can see that almost the entire mammogram is white, and it would be really hard to see a white breast cancer in that. Only 10% of women are in category D and 40% fall into category C. So in reality, 80% of people with breasts are in these middle 2 categories. The category D people are the ones who, in my opinion, would really benefit from things like MRIs and potentially ultrasounds as well. But typically everyone in category C as well as category D does get a letter from the mammography center that says something like, you have dense breasts, you may benefit from additional supplemental screening, and we may not be able to see a cancer as well in your dense breast tissue. Only category D, or extremely dense breasts, are going to be at a slightly increased risk for breast cancer. Most women do not have dense breasts, even if they think that they do.